Hello, I'm Deanna Cochran. I'm an RN and founder of Quality of Life Care, LLC. We're an end-of-life and palliative care education training company, training service providers, developing corporate programs for hospices, and currently beginning a training within a chaplaincy graduate school program, the first of its kind. So I want to let you know what's going on out here as far as end of life and what is needed, how solving some of these problems, and the projected need of what's coming and how we can fill that. COVID showed us what happens to our healthcare system when it meets a demand that we currently don't have the resources for. We know what's coming. We know that the baby boomers are already taxing the system with their chronic illnesses and extended lifespans. And the silver tsunami, as they're calling it, is already showing itself in our ERs and ICUs. The gaps between the different entities is because the admissions criteria is changing and tightening. And so there are more people who aren't able to go to the next level of care or to go between entities because they don't meet the criteria. So people are floundering at home on their own, trying to figure things out. And these are the ones, they're in the time period I call when treatments begin to stop working to hospice entry. That time period, that's when all of this is really crucial. This is a place where end-of-life doulas can be helpful, and I'll explain more about that later. So this time period between when treatments begin to stop working and hospice is my focus during this presentation. The role of the end-of-life doula is brand new, and it bridges these gaps. It bridges also the gaps within hospice. Hospice has definite areas, especially between when the person dies and bereavement. There's a huge gap right there. Medicare requires hospices to do bereavement services. However, the segue isn't clean, it isn't nice. Most bereavement services is a monthly card. So you can see right there that at death, there's a huge area for improvement. Doulas can fit in right there. So the gaps I've already noted prior to hospice, those are areas if a doula is well trained, they can easily help a family navigate. So the perfect storm is, we know by 2030, there will be more people over 65 that are under 18, first time in history. We have a shortage of physicians that's projected. We have right now, the demand for palliative physicians far exceeds supply. It's going to continue. Right now, pre-hospice palliative care access is not consistent across the country, even within the same city. So urban areas get most of the pre-hospice palliative care services, rural, very, very slight. And the differences between program is outrageous. And end-of-life doulas can help with that as well. By 2030, we expect a reduction of the amount of non-paid caregivers per person, and it'll be quite significant. 80% of people want to die at home. The biggest gaps in healthcare is after hospital discharge, and you'll see the bullet points here of what they are. End-of-life doulas are trained to handle these right here. There is an awareness now, pretty good one, of end-of-life doulas in the media, within professional organizations. When a family hears of end-of-life doulas now, there's articles written about how people would like one, where do they find one? Hospices are looking into developing corporate programs. The awareness is here, and it's only going to grow by the time 2030 comes around. End-of-life doulas have this unique position and a unique ability to begin to navigate, guide, support in every kind of way, non-medical, from when treatments begin to stop working into death, into post-death, actually. I recommend about 2 months after death. So that's a very specific time period where people are really flailing. If someone comes into hospice, they're fine. But what is going on is that hospice referrals are super late. The NHPCO stats show that it's the last 2 weeks of life where most people come in. They should be coming in much sooner. We fully expect by 2030 that end-of-life doulas will be as common and as recognized as the birth doula. We not only have individuals realizing that they can provide this kind of service, we also have consumers that want it, and we have healthcare organizations acknowledging it and respecting it and validating it. So the definition of a doula is non-medical support, non-medical end-of-life specific support with these aspects. It's a supportive role to families as well as to hospice. There's an end-of-life expertise that we can't emphasize enough. There are many healthcare kinds of companies, non-medical kinds of companies, but they're not end-of-life trained. Most of them have no expertise in end-of-life. The only people right now that actually trains end-of-life is hospice. That was before the end-of-life doula movement came around. They provide practical emotional support. They're an adjunct to hospice as well. Currently, there is no board to regulate doulas or to license them. It is a role that most people have demanded. They wanted a certificate. I was the first program for years, and they very specifically and definitely wanted to have a certificate. And then when healthcare began to learn of this, they also wanted some kind of certification. So it's pretty standard and pretty common, and most wanted is this certificate. I told you about the professional organizations that now are legitimizing the role. One is the National End-of-Life Doula Alliance, the nonprofit membership organization for doulas, creating standards of practice, code of ethics, all of that. Also, the NHPCO, End-of-Life Doula Advisory Council. They invited us to the table in 2018 and wanted us to educate. There's over 6,000 member organizations about end-of-life doulas and how to utilize us within their organization and utilize the community doulas, help them bring programs in to tell them what to do, etc. Let me share some benefits. By default, we're an advocacy role. I call it a gentle advocacy. We're there, we're witnessing, making sure they have what they need, making sure they have the resources they need in the community. They're helping the family plan. They're helping the family with all kinds of things in the present day for the future, helping them with practical, emotional, and spiritual needs. They guide to palliative care services, pre-hospice palliative care. They guide to hospice. What they're doing is looking and seeing what's going on. The doulas that train with me, we have a very heavy emphasis on pre-hospice palliative care support, helping the family to see that maybe they need the specialized care of a palliative care expert. Maybe they want to talk to hospice just for a visit, just to see what that service is about and when would their loved one be ready for that. They're ready to help families to get those resources that they're lacking. If everything's going well, great. Most of the time, we know that that's not the way it is. They're also very strong in bedside vigil support in those last days, which obviously also helps the hospices as well. Most doula sessions are anywhere from 2 to 8 hours. Because they're around, that fragmentation is lessened. When doulas are around, people do not fall through the cracks. We're being utilized by families right now, by hospices and by community organizations. There are many volunteer doulas, and there are also many professional doulas that are fee-for-service providers. I want to give you some context on the end-of-life doula role. I want you to know it didn't just surface 5 years ago. We have Dame Cicely Saunders here, the creator of the hospice movement. And we have Phyllis Farley in the blue, who is a birth doula, an advocate and philanthropist for that movement. She went to an end-of-life conference with the Shira Rescue Center and saw how they were caring for their dying and likened it to the birth doulas and the way they cared for the birthing. And so she coined the term end-of-life doula, and they created a program which in 2001, Care, the doula to accompany and support, became their own nonprofit. And then in 2003, he heard about all this going on and created a doula program within the volunteer department as a hospice. And then I come along in 2005. My primary purpose was to train, educate lay people on all the things that they could be giving and supporting their families prior to hospice, because that is where most of the suffering is happening and people come onto hospice far too late in the process. So here's some milestones that I just shared with you. Also, I want you to know that in 2010, 2 end-of-life doula certificate programs, the first in the world, one was in US, one was in UK, and yes, I had the one in the US. Next group of things that happened in the whole history of our movement, we had our first doula directory, our first doula and palliative care podcast. Our grassroots movement became visible everywhere. News articles. NPR was on it. Everybody is talking to us, and various people are waking up around the world to leading this movement in their countries as well. And we had the National End-of-Life Doula Alliance formed in 2017 and 2018, the NHPCO Council invitation. The first book on end-of-life advocacy for doulas and healthcare advocates was in 2019. Latin America began exploding in 20. My book was published in Spanish this year, and also this year is the first time an end-of-life doula certificate program is being taught within a CPE graduate chaplaincy program. So I'd like to tell you what I've been doing since 2005. This is when I founded Quality of Life Care LLC, and it was a pre-hospice palliative care training and education and consumer advocacy initiative. I realized early on to make big change, you needed to bring big public awareness. And so I joined with NHPCO and did a couple of years of the World Hospice Day events. It was a really successful initiative for us. In 2010, I had the premier end-of-life doula certificate program in the US, and we were one of two in the world at that time. So the other programs started coming in around 2015. In 2013, I found it was necessary to bring families together with private practitioners in a variety of end-of-life services. I also wanted consumers and other healthcare professionals to know there was this new role called end-of-life doula. So it felt brilliant to me to bring them all together here for the first time, and people, doulas being alongside of doctors and nurses and social workers. Families began to not be afraid of that role, end-of-life doula, because it was brand new. Also, other healthcare providers started inquiring about it, and many people, holistic practitioners, hospice nurses, healthcare professionals of various kinds, feel this end-of-life doula concept goes very well with whatever role they're presently doing. 2014, I created the first palliative care podcast and trained and taught and interviewed all kinds of leaders in palliative care. 2017, I partnered with Hawaii's only nonprofit. We had a few years of these wonderful international death doula conferences that brought together people who had been doing this work remotely for over 30 years. 2017 is when NIDA was created, and I was part of that. In 2018, I was invited to be the first chair. We did a lot of good work. 2019, my book was a #1 Amazon bestseller in 3 categories. It's a practical, hands-on book. In 2020, Latin America has just exploded in developing doula pathways. It has been led by CareDoulas. Also this year, my book was published in Spanish, and it is going to unify the leaders down there to discuss what can be done in their country. Also this year, I was invited to bring certified care doula into a graduate chaplaincy program, their CPE program. The market is incredible right now for graduate school, for hospices and hospitals, just to start with. There's so much more that I can share with you.